Hello, Professor Paprika. First of all, I want to thank you for just giving me the time to actually finish your course to completion. So, for the PowerPoint, this is going to be the comparison of the Ombudsman offices, and I'm going to be comparing LAPD to California Department of Health Care Services. Okay. So, the Ombudsman's office, I just wanted to let you know how I actually collected that information from LAPD and also from California Department of Healthcare Services. So for LAPD, I actually got to speak with senior personnel analyst Cynthia Winston. She was actually really helpful to where I actually spoke to her for maybe about 30 minutes, if I remember correctly. So a lot of the interviews and information I got was actually directly from Cynthia Winston, who works at the Ombuds office at LAPD. The rest of the information I got scattered through LAPD's website. For the California Department of Healthcare Services, I was able to speak with the ombudsman there as well, and her name was Katie. We spoke for only about 10 minutes. She did not give me too much information, but the information that I'm about to present on the PowerPoint is a good summary of what she gave me. A lot of the information that I did get was actually not even directly from the Department of Healthcare Services. It was actually from other websites that's linked to Department of Healthcare Services, but it wasn't exactly from the DHCS's Ombuds office itself. So when it comes to comparison, I would really like to just focus on LAPD because they did a great job and she gave me the respect and the time to really speak to me regarding their process that I'm going to present to you now. And just having the time and uh, the knowledge, most importantly, the time and the knowledge to actually give me her experiences and break down for me exactly how their ombudsman's office is run. When it came for DHCS with Ombudsman Katie, I definitely had a difficult time even trying to build a rapport with her. I started out the phone call introducing who I was and exactly why I was calling her, and within 10 minutes, she was pretty much trying to usher me to their website, which to be quite honest, wasn't very helpful. She was trying to just usher me off the phone because she was politely telling me that she had many other calls coming in that she was responsible for. So overall, when it comes to um, servicing guests who are calling them, LAPD definitely does have that definitely has more time, and the person who's on the phone has a good amount of experience. Ombudsman Katie actually didn't even tell me how long she's been working there or what kind of experience that she has. So I'm not sure if she is just the spokesperson and the person receiving calls, and there are other ombudsmen that are actually investigating, or if she is responsible for picking up phone calls and investigating. So overall, the LAPD's ombudsman's office, if you call in, you definitely will definitely get service, and the person picking up the phone call will actually be able to speak to you and not usher you off the phone and give you good information. So, moving on, the LAPD's Ombudsman's Office was created in 1997 by Chief Parks. The LAPD defines their ombudsman as a designated neutral or impartial dispute resolution practitioner whose major function is to provide confidential and informal assistance to manager and employees. I want to focus on this really quick. So usually police departments are so small or so busy that everybody has collateral duties. What was so great about LAPD was that they actually set aside these seven sworn police officers, and dedicated them to their own ombudsman's office to make sure that their department has an ombudsman office. For the California Department of Healthcare Services, their ombudsman's office was created due to Title 22, California Code Section 53893. I actually did spend a bit of time trying to research Title 2 California Code Regulation Section 53893. I couldn't find, number one, I couldn't even find when this regulation section was put into effect. I researched on their site, off sites, and sorted through a couple websites, and even dared to go on Wikipedia, and I didn't find any information about t this regulation section where actually I could actually quote. Um, but on their website, they define the Ombudsman Office as the office that shall provide Medi-Cal beneficiaries a service which investigates and resolves complaints about managed care plans by or on behalf of Medicare beneficiaries. I think this definition here is very broad versus LAPD's, California Department of Healthcare Services. Uh, their job, their office is to investigate and resolve complaints, as it says there on our PowerPoint. Um, but I'm not sure if the statistics that I will give you in a couple slides, present to you in the next couple slides, we're not sure if those phone calls or those investigations are directly for the Medi-Cal beneficiaries or the on behalf or the folks on behalf of Medi-Cal beneficiaries. So I'm not sure the statistics when it comes to that, if it's the actual beneficiaries of Medi-Cal calling and asking for help, or if it's, say, their spouse or their children or their grandchildren helping. Versus when it comes to LAPD, their statistics are for employees only. So at least we know that the numbers that were given by LAPD that I'll present to you are strictly from LAPD. So how does the Ombudsman Office run? I thought it was a good idea to just compare personnel numbers. LAPD, as of 2021, they have 7 designated ombudsmen, and they service 12,000 of their, LAPD consists of approximately 12,000 sworn and non-sworn staff. So the 7 designated ombudsmen actually serve these 12,000. Going back in the cases here, they have in 2018 they had 25 cases, and in 2019 they had 34 cases that they had to take care of, which I'll expand later on. California Department of Health Services has actually 20 to 25 ombudsmen, not for like SoCal, but for the whole entire California, and that's probably where we're going to see some problem here. The 20 to 25 ombudsmen service approximately 12 million Medi-Cal clients. Of course, I can't tell you exactly the breakdown of the, the statistics that you're looking at now from July 2017 to May 2018. I can't tell you if where they are from. I can't tell you the Medi-Cal clients, their age. They didn't break, the statistics weren't broken down to age, they weren't broken down to illnesses, they weren't broken down to what part of California they're from. So I also thought it's really important to go over their training. LAPD has an extensive training for their ombudsman, and very, very impressive. As you know, Professor Paprika, I've gone to several courses, including the FBI's hostage negotiation, crisis negotiation course, and I believe even the FBI's negotiators, their training will closely rival LAPD's, or vice versa. The LAPD's will Ombudsman Office will rival even that of the FBI's. So the LAPD has for them to even start a case and handle a case, LAPD Ombudsman must complete the following: a 3-day dispute resolution with LA City Attorney's Office, a 4-day peer counseling class, the basic and advanced ombudsman course from the actual Ombudsman Association that we know of and that we know is so famous here in the U.S. that started the Ombudsman Association. Excuse me, the Ombudsman Association is the USOA, just the United States Ombudsman Association, just so we could get that clear. The LAPD Ombudsman also need to complete a 5-day mediation course with the Collaborative Decision Resources Associates in Colorado. These folks in Colorado supposedly are some pretty good folks and have a lot of experience, not only in handling mediations but also teaching mediation. They also need to complete a 40-hour conflict resolution course at Pepperdine University. And as we both know, Pepperdine University excels and holds itself to a very high esteem for their conflict resolution course. But the LAPD's most impressive training is actually the 160 hours plus of mediation that they shall do with LA City Attorney's Office. That is the mediations they're doing with families or victims of crimes, things like that. So that's actually very, very, very impressive. I don't know any other departments, police departments, in LA County or San Bernardino County that actually does the mandatory mediations with the attorney's office. So that's really impressive. Now let's compare the California Department of Health training. So when I spoke to Ombudsman Katie on the phone, she pretty much told me that they have a state-approved in-house training and an annual approved training. Um, in order for them to be hired, they need at least a bachelor's degree of some sort that's related to the duties of ombudsman. Now that's really broad, and she didn't tell me what she majored in for her bachelor's. And she also couldn't give me a website or a list of the state approved in-house trainings, nor could she give me what their annual approved training consists of. So when it comes to training, LAPD definitely um, LAPD's ombudsman's training is absolutely superior over California Department of Healthcare Services. We have actually no idea. We have no documentation online that I could find about what kind of training they go through. So the Ombudsman's office's different tasks and responsibilities. Let's start with LAPD again, since we've been doing that, starting with LAPD for the last few slides. So the LAPD Ombudsman office is their ombudsmen are tasked with investigations, but not only investigations as an ombudsman, but they also have a couple other duties here. They do mediations, and it's what's quite impressive is they do private counseling for family members of police officers, so police officer and family members. She, the person I spoke to actually told me that they allow even wife, say the significant other of the officer, and even children of the officers. And what I thought was really awesome was for young officers, parents as well. So they do a lot of private counseling, which I thought was really great. So if we go back to their training, that is why they actually spend a good amount, like a 4-day peer counseling, and also of a 3-day dispute resolution. So they bring that to the counseling sessions. So the counseling sessions are not only with family, but of course with coworkers, being that police officers have pretty strong A-type personalities. LAPD also, Ombudsman Office also has the responsibility of doing briefing and roll call trainings for de-escalations, for mediation, for crisis negotiation, not for citizens, but within each other. And so that's why I wrote prevention there, because I thought LAPD does a great job trying to prevent escalation, trying to prevent hostile interactions within within the LAPD. So being able to have the time and the resources and the support to actually go to briefings and roll calls to provide that kind of training is excellent prevention. Now, if we go to California Department of Health, their ombudsman's office are that I could find, and from the limited conversation I had with Ombudsman Katie, is strictly investigation as an ombudsman. So their job is to assess from the phone calls, the emails, and the online submissions, and they determine whether or not it meets the criteria to investigate, and if not, then they pass it off. Excuse me. So moving on, like I said earlier slides, I wanted to focus a little bit on the caseload of the different ombudsman's offices. For the LAPD, 2018, 25 cases, 2019, 34 cases. So when I actually talked to LAPD's Cynthia Winston, she actually told me that the reason why it jumped from 25 to 34 in 2018 2019 is actually because of word of